Alright, welcome to presentation on heat stroke and heat exhaustion to severe effects of heat. And this presentation is by Dr. Ignatius. So, what are the differential diagnoses for elevated core body temperature? One is obviously in fever, there is a elevated body temperature. Other are heat illness, heat exhaustion, heat stroke, sepsis, including meningitis, malaria, drug overdose, malignant hyperpyroxia, and thyroid storm. In these conditions, the temperature actually increases very high. Heat exhaustion. Heat exhaustions occur with prolonged exertion in hot and humid weather, like someone is exercising and doing heavy manual labor in hot, humid weather. There is profuse sweating, and there is inadequate salt and water replacement. The core temperature, that is the rectal temperature, is 37 degrees Celsius to 40 degrees Celsius. Investigations can reveal dehydration with mild elevation of blood urea, sodium, and hematocrit. So, how do we treat the heat exhaustion? That is, we will remove the patient from the heat, and then we'll do tepid sprays and fanning, and then we'll give oral rehydration solution or IV isotonic saline up to 5 liters in 24 hours. Heat exhaustion may progress to heat stroke unless it is treated. So, about heat stroke. Unlike heat exhaustion in heat stroke, the core body temperature is actually very high. It rises over 40 degrees Celsius and it is a life-threatening condition. So the symptoms of heat stroke are headache, nausea, and vomiting. There are neurological manifestations like coarse muscle tremor and confusion. The person becomes very aggressive, and there can be loss of consciousness. This does not occur in heat exhaustion. The skin is very hot, and there is no sweating. And the complications of heat stroke can be hypovolemic shock, lactic acidosis, DIC, which is disseminated intravascular coagulation, rhabdomyolysis, hepatic failure, renal failure, pulmonary edema, and cerebral edema. So the treatment of heat stroke is by at first we'll resuscitate the patient with rapid cooling by spraying with water, fanning, and ice packs in the axilla and groins. We'll give the cold crystalloid intravenous fluids to replace the fluid deficit. There no potassium containing fluid or overaggressive fluid replacement should be given because overaggressive fluid replacement will cause cerebral edema or pulmonary edema. And we should also monitor fluid balance, including the central venous pressure. Heat stroke is best managed in intensive care after emergency management. The recovery of heat stroke is quite rapid if there is appropriate treatment, and it results in 1 to 2 hours. So a look at this picture. It is a clear and concise summary of heat exhaustion and heat cramps. You can screenshot it and save it. Look guess which one is heat exhaustion and which one is heat stroke. You can take a guess. Seeing the symptoms. Right, there is loss of consciousness on the red side. There is no sweating. Temperature is over 103 degrees Celsius. The skin is red hot dry. Whereas in the other one, there's skin is cool, pale, and clammy. There's sweating. So the yellow one is heat exhaustion, and the red one is actually heat stroke. Thank you, and please subscribe to Ignatius School for more medicine videos.